Did you know that mapping out every single public restroom on your drive to the golf course or the grocery store isn't just a minor annoyance? It's actually a form of psychological conditioning that tells your bladder to shrink? Millions of active adults over the age of 60 are completely restructuring their retirements, avoiding long road trips, and turning down invitations to play around with friends, all because they assume that an unpredictable bladder is just an inevitable tax you pay for getting older. But the truth is, your bladder isn't worn out, it is simply untamed. And the common advice to just live with it or rely on adult diapers is completely wrong. I am Dr. Carl. I have spent the last 16 years practicing as a urologist, helping thousands of seniors reclaim their independence and their confidence. In this video, we are going to walk through the exact 9 crucial keys to mastering the one specific exercise that can rebuild your bladder control after 60, completely transforming your daily routine. We will break down how to stop the sudden panic leaks, how to train your brain to stop listening to false alarms, and how to properly activate muscles you probably don't even know you have. Make sure you stay tuned for number 7 because it addresses a massive mistake involving how you drink water that is actively sabotaging your progress right now. Before we dive into the first key, I want to ask you a quick question to help me understand your situation better. How many times a day do you find yourself rushing to the bathroom out of pure panic? Or how many times do you wake up in the middle of the night? Drop your number in the comments below. I read every single comment personally, and your real-world experiences directly shape the topics I cover next to help you navigate your health journeys. The first critical step we must address is breaking the habit of what I call the precautionary restroom visit. Many seniors, before they get in the car to visit the grandkids or head out for a walk, go to the bathroom just in case, even if they don't actually feel the urge. What is actually happening in your body when you do this is a slow disruption of your bladder's natural signaling system. Think of your bladder like a balloon that slowly expands as it fills with fluid, sending a gentle signal to your brain when it is about half full. When you constantly empty it before it reaches that point, your bladder begins to adapt to a much smaller volume, essentially shrinking its functional capacity and making you feel like you have to go all the time. A review published by the American Urological Association highlights how behavioral training, including breaking this cycle of anticipatory urination, is foundational to overcoming urgency issues. This week, I want you to try a simple action step. The next time you feel the urge to go just in case before leaving the house, consciously pause and ask yourself if your bladder is truly full. If it isn't, challenge yourself to wait another 15 or 20 minutes before you head out, allowing that muscle to stretch naturally. Of course, if you ever experience pain or burning when trying to hold it, that is a clear sign to talk to your doctor at your next annual physical to rule out an infection. Moving on to the second element, we have to talk about finding the invisible muscle, which is the cornerstone of the one exercise that rebuilds your control. Most people assume they know how to strengthen their pelvic floor, but studies show that a vast majority of seniors are actually squeezing their glutes, their inner thighs, or even holding their breath instead. Imagine your pelvic floor as a supportive hammock made of muscle that cradles your bladder, your bowels, and your reproductive organs. When this hammock loses its tone after 60, the support structure sags, making it incredibly difficult to close off the urinary tube when pressure is applied. Research from the Mayo Clinic emphasizes that isolating this precise muscle group is the single most effective non-surgical approach to treating stress incontinence. This week, to locate this muscle properly, the next time you are sitting comfortably in a sturdy chair, try to imagine that you are trying to stop yourself from passing gas without moving your legs or tensing your stomach. You should feel a distinct internal lifting sensation, almost like an elevator moving up a floor or two inside your pelvis. The third key is mastering what urologists refer to as the quick flick technique, which is the immediate, practical application of that muscle contraction. Many seniors think that bladder exercises are only useful when practiced quietly in bed, but you need protection out in the real world when you cough, sneeze, or lift a heavy bag of mulch in the garden. What is happening mechanically is that a sudden increase in abdominal pressure overpowers the weak sphincter muscle at the base of your bladder, causing an involuntary leak. By utilizing the quick flick, you are essentially pre-bracing that hammock structure right before the impact occurs, acting like a structural shield. A study published in the Journal of Urology confirms that timing these brief, intense muscle contractions right before a physical trigger dramatically reduces what we call stress leaks. Your actionable step this week is to practice 3 rapid, powerful squeezes and releases in a row, holding each for just 1 second, multiple times a day. Try doing this while you are waiting in line at the pharmacy counter or sitting at a red light, so it becomes second nature before you ever feel a sneeze coming on. Our fourth component is understanding the deep connection between your breathing diaphragm and your bladder floor. Many active seniors tend to hold their breath when they exert themselves, whether they are swinging a golf club or lifting a heavy skillet in the kitchen. When you hold your breath and push down, you create a massive amount of internal pressure that forces your bladder downward against a weakened pelvic floor, creating a perfect storm for an accident. Think of your torso like a cylinder of air, where the breathing diaphragm is the lid and the pelvic floor is the base. If you compress the lid without letting air escape, the pressure has nowhere to go but down against the base. Many doctors are seeing excellent results when patients learn to coordinate their breathing with their movements to protect this delicate balance. This week, make a conscious effort to blow air out through your mouth whenever you are standing up from a low couch, lifting something, or bending over. Exhaling naturally relieves that internal pressure, taking the sudden strain off your bladder muscles. Quick pause right here. If this information is connecting the dots for you and helping you make sense of what you are experiencing, please take a moment to tap that like button. It truly helps this video reach more seniors who are quietly struggling with these exact issues and looking for real solutions. And while you are down there, tell me in the comments if you have ever been told that leakage is just a normal part of getting older, because I hear that misconception far too often. Now for the fifth key, we must address the over-squeezing mistake, which is a massive trap for well-intentioned people. When seniors discover the importance of pelvic floor exercises, they often start squeezing these muscles as hard as they can, all day long, thinking more is always better. However, what actually happens inside the body is muscle fatigue and hypertonicity, meaning the muscles become so tight, exhausted, and cramped that they can no longer contract quickly when you actually need them to prevent a leak. Imagine holding a heavy grocery bag with your arm bent at a 90-degree angle for 3 hours straight. Eventually, your biceps will become completely exhausted and useless when you need to lift something else. Clinical observations frequently show that over-tightened pelvic muscles can actually worsen urgency and make it harder to empty your bladder completely during your regular restroom visits. This week, ensure that every single time you practice a muscle squeeze, you spend an equal amount of time consciously letting the muscle fully relax and drop back down to its resting state. Sixth on our list is managing the gravity factor as you build your strength up over time. A common error is trying to perform these exercises while standing up on the golf course or walking around the neighborhood right from the very beginning. When you are upright, gravity is actively working against you, pulling the weight of your internal organs down onto a pelvic floor that is already struggling to cope. It is much like trying to bench press 100 pounds on your very first day at the gym instead of starting with lighter weights to build proper form. Research has linked gradual positional progression with much higher success rates and far less frustration for patients undergoing bladder rehabilitation. This week, do all of your bladder exercises while lying flat on your back in bed each morning or evening, which removes the burden of gravity and allows your muscles to build a solid foundation of strength without fighting the weight of your upper body. That brings us directly to number 7, the hydration paradox that I warned you about earlier. So many seniors who suffer from leaks make the logical decision to drastically cut back on the amount of water they drink, thinking that less fluid in means less fluid out. What actually happens inside your body is the exact opposite of what you want. Your urine becomes highly concentrated, dark, and acidic. This dark, concentrated fluid acts as a severe chemical irritant to the sensitive lining of your bladder, causing the bladder muscle to spasm and send urgent, panicked distress signals to your brain, even when it is barely full. A comprehensive Mayo Clinic review notes that maintaining adequate, steady hydration throughout the day actually dilutes the urine, calming the bladder surface and reducing the sudden, uncontrollable spasms that send you running to the bathroom. This week, instead of chugging large glasses of water all at once, carry a reusable thermos with you and take small, consistent sips throughout the day, stopping your fluid intake about 2 hours before you go to bed. The eighth item we need to look closely at is the impact of everyday bladder irritants that might be slipping into your daily routine. Many comfortable retirees enjoy a premium morning coffee, a couple of glasses of iced tea during a hot afternoon, or a nice glass of wine with dinner. While these are wonderful elements of a relaxed retirement lifestyle, caffeine, alcohol, and even certain artificial sweeteners are known pharmacological triggers that cause the bladder muscle to contract prematurely. They act like a loud alarm clock going off right next to your bladder, tricking your nervous system into thinking you have an emergency when you really don't. Some studies suggest that simply reducing your intake of these specific triggers can cut your urgency symptoms in half without any other medical interventions. This week, try swapping out just one of your caffeinated beverages for a high-quality Swiss water decaf or a soothing herbal tea, and observe how your body responds over the following 48 hours. Finally, our ninth key is understanding the concept of progressive endurance for your bladder. Rebuilding control after 60 isn't just about how hard you can squeeze, it is about how long those muscles can hold the line when you are stuck in traffic or waiting for a delayed flight. If your pelvic floor muscles can only hold a contraction for 2 seconds before giving out, they won't be able to protect you during the 2 minutes it takes to unlock your front door and walk to the bathroom. Many urologists see significant long-term improvements when patients focus on building up the duration of their holds rather than just the number of repetitions. This week, when you are performing your resting exercises, try to hold a moderate, steady squeeze for a full 5 seconds while breathing naturally, then build up to 10 seconds over the next few weeks. To show you how all of these pieces come together in real life, let me tell you about a past patient of mine named Harvey. Harvey was 72 years old, recently retired from a successful career, and spent his winters down in Naples, Florida. He loved playing golf 3 days a week, but he reached a point where he was terrified of the drive to the country club and found himself constantly slipping away to the bushes between holes, which left him feeling deeply embarrassed and isolated. He was secretly spending a significant amount of money out of pocket at the pharmacy counter for protective pads, and he feared that his active lifestyle was completely over. When Harvey first came into my office, we didn't talk about surgery or heavy medications. Instead, we broke down these exact principles, starting with locating his invisible muscle and stopping his precautionary bathroom trips. In the first 2 weeks, he focused entirely on doing his exercises while lying down and swapping his afternoon caffeinated iced teas for water. By week 4, Harvey learned to use the quick flick technique right before he swung his golf club or got out of his golf cart. Within 2 months of consistent, daily practice, Harvey proudly told me during a follow-up visit that he had completed an entire 18-hole round with his friends without a single leak or a moment of panic, completely reclaiming the active retirement he had worked so hard to earn. Let us put together tonight's plan with 5 simple, concrete action steps you can start utilizing today to get these results for yourself. First, stop going to the bathroom just in case before you leave the house, and only go when you feel a genuine need. Second, practice finding that internal lifting sensation while sitting quietly in your favorite chair tonight. Third, commit to exhaling thoroughly through your mouth every single time you stand up or lift something heavy tomorrow. Fourth, keep your fluids steady by taking small, regular sips of water throughout the day rather than cutting back on your drinking entirely. Fifth, dedicate just 5 minutes tomorrow morning while lying in bed to performing 10 controlled, steady muscle squeezes with equal periods of complete relaxation. In our very next video, we are going to explore a surprising dietary staple found in almost every American pantry that modern research shows is quietly irritating your prostate and bladder every single night, completely disrupting your sleep patterns. I am Dr. Carl. Stay well, and I will see you there.